Hello family and friends. Again, I'm here again with you. My name is Kiara Royer from Buddy Services Center for Seniors. And if you have not yet subscribed to our channel, please go ahead and click the button and subscribe for all the new contents that's coming in the future. Today, I'm going to be talking about the 3 essentials. And you might be wondering what are those 3 essentials, but these things are very important if you are caring for a loved one. So one of the first things you want to have is the oximeter, and I'm going to go into details, the importance of oximeter. And secondly, you want to have a blood pressure machine at home. And thirdly, and most people forget about this one, but it's essentially as important as the other 2, is a thermometer. And we will talk more about that soon. Before we get started into the 3 essentials, I wanted to make note of this, that health monitoring and medical care are fundamental components of caring for an elderly at home. By maintaining regular checkups, monitoring vital signs, managing chronic conditions, and ensuring effective communication with healthcare providers, you can help ensure the well-being of the individual that you're caring for. The communication is vitally important. Keeping in contact with the doctors, the PSWs, family members, all 3 of you working in unison to provide the best care for the person that you are caring for. Okay, so let's start with the thermometer. It's one of the essentials because it is important. Each day when the person that you're caring for awakes, thermometer, take their temperature first thing in the morning, because what you want to determine is what's their baseline. Whatever the baseline is, you want to record that in a book, because when you see a spike or a drop as you check them daily, it's an indication that something is wrong. For example, if every day you're testing the temperature of the person you're caring for and it is 37 degrees, 37 each day, and the next day you do it, it's 39, that's a clear indication that there is a fever. And then you want to know what is the cause of the fever. Oftentimes, when there's a fever or increase in temperature, it's a sign of infection. This is why it's so important for us to take their temperature daily and not just take it and thinking that you're going to remember it. You want to record it. I always recommend to my clients, get a notebook, and each day you date the book so that you have a record of what their temperature is every day. Okay, the next piece of equipment you want to have at your home is the oximeter. The oximeter is used for 2 things. One, it gives you the oxygen saturation and also gives you the heartbeat at the BPM. So how this is used is you put it on their finger. You want to ensure that hands are nice and warm, because if it's cold, you'll get an incorrect reading. Also, if they got nail polish on like I do, it will also possibly give you incorrect reading. So you place it on your finger, turn it on, and you will get a reading. You want to ensure when you get the reading, you want to ensure that their oxygen saturation is above 95. And you record that every day. So let's say on Monday it was 99, on Tuesday it was 99, on Wednesday it was 97, and then Thursday, you see that 85. Again, that's a red flag. There's something going on in the person's body, and you want to call the physician. I will advise you not to rush them to emergency. You know, a healthcare system right now, they will sit in emergency for hours, and which is something, and I don't know about you, but I don't want to sit in emergency for hours with a whole bunch of sick people. So my advice to you is call telehealth. Let them know that generally the person you're caring for, their oxygen saturation is around 99, 97, 100, but today it's at 85. There's no signs of trauma. There's no signs of restriction in their breathing, but the oxygen saturation has dropped. They can also give you advice, because there's nurses at the other end of that, and they may say take the person to emergency, but you want to check first before rushing to emergency and sitting there for hours. So a very great tool. Again, you want to record this in that same notebook I mentioned earlier. Record what their oxygen saturation is, the SpO2. Record that in the book. Again, it's useful for if you have to call telehealth You have that information documented saying that over the past week, the past months, the past year, this is what it has been, so you're concerned. Now, usually when the oxygen saturation is below 85, it means that person is having difficulty breathing. So this is why it's important for you to pay attention to those numbers. The third piece of the 3 essentials is the blood pressure machine. You want to ensure that you have one of these at home and that you're taking the person that you're caring for blood pressure each and every day. Again, I like to give examples. If on Monday their blood pressure was 150 over 85, Tuesday it's more or less the same. Wednesday you see that it's skyrocketed to 160 over 100. Again, that's a clear indication that there's something happening in their body. You don't want to take this lightly. You want to again reach out to telehealth, let them know the age of the person you're caring for, what their average is, what their baseline is, and you want to let them know that today you've noticed that their blood pressure had spiked. It could be that they're having a heart attack, it could be a TIA, it could be a number of things, but you want to seek help. Again, I don't always recommend you rushing to emergency to sit there for hours, but call a telehealth, call a nurse, call someone who can give you directions, and maybe it's just dehydration. Oftentimes our blood pressure would peak if we're dehydrated, and it could be simply that they haven't eaten or they haven't drank anything for the last 6, 8, 10, 12 hours. Simple thing as giving them fluid into their body can bring that their blood pressure down. So again, my caution to you is when you see a change, and again, you want to record this daily in their book. In the event that you do have to call 911, when 911 comes and you have this information, you can say to them, listen, mom is usually or dad is usually in good health, but today their temperature went up to 101. Their oximeter is reading below 85 SpO2, and their blood pressure spiked. You can give them to say right now it's 160 over 85. It's usually, you give them what the baseline is. That gives the paramedic a whole lot of information right there. It may not mean anything to you, but for a healthcare profession, they know exactly what that means. They know what to look for. They know what help to provide at that instant, rather than they going through a whole lot of different tests before they by giving them that information, they can say to you right away, we're going to take this person to the nearest hospital. That information means a lot to them. They can decipher from it how urgent it is. And as us as caregivers, we don't often like, especially if you're caring for a parent or a grandparent or any family member. I know if you're like me, I don't like running to emergency on the onset of anything. But I'm encouraging you to do call for help. Even if you call the paramedics and you told them what the vital signs are, they can determine whether this is a cause for emergency, or they can say watch them until, if something changes, then do call us back again. So I just wanted to leave you with those information. It is so vitally important for us, and I cannot stress this enough, for us to keep a record of these numbers. Even if you call the doctors that come to your home, and I will share that information with you shortly. There is a number that you can call where the doctor will do home visits. They will check them. Sometimes, they will do a quick urine test. They will order it, and that will give a lot of vital information as well, rather than going to emergency. By now, I'm sure you know that I don't like going to emergency. Yes, I do not. But there's so much that we can do at home that can restore life, or can restore their vital signs to the normal baseline by just doing certain things at home. So I will give you the phone number for it will be somewhere on the screen below. I'll give you the phone number for the doctors on call. They do come to your home and they will do thorough checkups. If they're concerned about a certain thing, they will order tests to be done. Again, you don't have to take the person that you're caring for out of the home. They will come, Life Lab will come to your home. They will do urine tests. They'll do blood work, anything that can be done, even stool tests. They will come to your home and do those tests. You don't ever have to take the person that you're caring for outside of the home. It is stressful for them. They don't like it. It's uncomfortable. So as much as we can to keep them comfortable, as much as we can to provide the best care possible, let's keep them at home. It's where they want to be and it's where they belong. So before we sign off for today, I want to leave you with 3 important things. Regular health checkups. They're vitally important. Schedule and attend routine health checkups to monitor ongoing conditions and assess overall health. Regular visits to the healthcare providers allow for adjustments of treatment plans and ensure that any new health concerns are addressed promptly. I know I just said regular visits. It doesn't mean you taking them out of the home. It means getting these healthcare support providers to come to your home. So keep that in mind. It is possible. Keeping an update health record, I mentioned that earlier to you, including medical history, current medication, vitally important. When the doctors come over or the paramedic comes over, you want to have a list of the medication that they're on so they can take a look at it. Sometimes it's just as simple as stopping a medication temporarily that can restore them back. So please be mindful of that, to share that information with healthcare providers and also EMS when they attend their home. These things can facilitate more effective consultation with healthcare providers. The next thing I'm going to talk about is monitoring vital signs. I'm just summing this up what I shared earlier with you. Using health monitoring tools at home can provide valuable information about an individual's health status. I talked to you earlier about the oximeter. It can measure blood oxygen levels, indicating respiratory health. Blood pressure machines can monitor hypertension and detect potential cardiovascular issues. Thermometer essential for identifying fevers, which can signal infection or other health problems. Ensure that these tools are used correctly and consistently, that the results are recorded properly each and every day. The third thing and final thing that I'm going to leave with you is managing chronic conditions. Chronic conditions such as diabetes, hypertension, and arthritis require ongoing management and monitoring. Ensure that treatment plans are followed diligently, including medication, adherence, dietary restrictions, and physical activity. Very important. Regularly review and update care plans with healthcare providers to address any change in the individual's conditions or needs. I hope this was helpful to you. Please subscribe to our channel if you haven't yet. Each month we'll be coming to you with new information, so stay tuned.